There was one headline that was so shocking, I think you probably saw it too, but it just blew my mind, and here it was. Indiana life insurance CEO says deaths are up 40% amongst people ages 18 to 64. I mean, the heart of America dying at a 40% increased risk. Well, we have the video that spawned these articles all over the country. This is that CEO. I think he's in some sort of national meeting, a Zoom call of sorts, and this is exactly what he had to say. He's not mincing words. He's telling the truth. Listen to it. This is terrifying.
We offer group life and disability insurance to employers. And we are seeing right now the highest death rates we have ever seen in the history of this business, not just at One America. The data is consistent across every player in that business. Now, this is primarily working age people, 18 to 64, that are in employers like all the employers on the screen here. And what we saw just in third quarter, we're seeing it continue into fourth quarter, is that death rates are up 40% over what they were pre-pandemic. Now, just to give you an idea of how bad that is, a 3 sigma or a 1 in 200 year catastrophe would be 10% increase over pre-pandemic. So 40% is just unheard of. And what the data is showing us is that the deaths that are being reported as COVID deaths greatly understate the actual death losses among working age people from the pandemic. It may not all be COVID on their death certificate, but deaths are up just a huge, huge numbers.
This is something we've spoken so much about. He's telling you it's not COVID, folks. That underestimates it. It's all-cause mortality, something you're only hearing being presented here at the High Wire. This is those deaths of people when they're out of work. This is those people that are dying from suicide. This is those people that are drinking themselves to death. This is the abuse that's leading to, a rise in crime and murder cases. All of this, the deaths, but 40%. Listen to what he said. To put it in perspective, when we look at, I think it was a once in a century, every 200-year catastrophic event, that tends to be about a 10% rise in death. We are looking at 40%. I mean, when I listen to that, and reading Scott Atlas's book, and I hope we can get him on the show sometime in the near future, this is what he was so frustrated about inside of the White House. The book's incredible because he keeps talking about no one wanted to talk about the all-cause mortality. No one wanted to talk about the suicides and the depression and all the issues that these lockdowns, that Deborah Birx, and yes, you, Tony Fauci, you will be held responsible for this. I will make sure you're held responsible for this. It's not just about COVID. How many people are you going to kill with these murderous policies? And so, when I think about these people and what they've done to us, and then I think about, there was a quote, I think we have it, where Tony Fauci talked about, who is hit hardest by COVID. Take a look at this.
At the end of the day, everybody got hit really badly. I mean, if you look at even the ones that thought that they were doing so great, like Germany and the UK and the EU, as it turns out, everybody had a problem. However, big however, that does not explain how a rich and sophisticated country can have the most percentage of deaths and be the hardest hit country in the world. That, I believe, should not have happened.
He's talking about the United States of America being the hardest hit, the richest nation, with the best hospital systems in the world, the biggest hospital malls. We've bragged about the highest paid, best educated doctors the world has seen come from all over the world to be in our medical system here. Here, we had the highest death rates. And he's talking about COVID, and now we're finding about all-cause mortality, all of the issues that we created. Here is the highest, and yet I have to read articles where they're discussing whether Tony Fauci is the sexiest man alive. The Guardian proclaims Anthony Fauci is the sexiest man alive. Are you kidding me? He's not only not sexy, he's downright moronic and stupid and terrifying, and he has overseen the worst handling of this epidemic in the world. I was talking to a doctor friend of mine. We were having a little bit of a spat. And he's like, well, I mean, you have your perspective, I have mine. He's like, yeah, here's my perspective. I mean, I get it. I know you're trying to do what's right, but we have the worst death rate by percentage, not overall numbers, by percentage than most of the world. How do you explain that? Because I know you're a good doctor. This hospital seems to have every piece of equipment and drug known to man. Why is it we're doing worse than Africa? And to prove that, here's where we're actually at. We looked at the numbers today. This is when you look at, these are by percentage per million. These are the amounts of deaths. So these are the countries. It starts Peru did the worst. And if you look at a lot of those countries, probably bury a lot of elderly. But here's the United States of America. Not number one, but I would say of all the large Western nations, we did the worst. Number 21. We're inside the top 10% of worst handling of COVID, with under the guidance of Deborah Birx and Tony Fauci and now all the other chuckleheads inside of our regulatory agencies. We have a death rate, I believe it's like 2,556 per million at 21. I mean, as you go down this list, even Italy, that started this whole thing and said, look, we have so many elderly, that's why we're dying. They did better than us. Mexico did better than us. Russia, Tunisia did better. Chile. In fact, you'd be shocked that there's not a single third world nation that did worse than us. In fact, they seem to be doing better than everyone else in the world. If you go all the way down that list, when you get into the 200s, that's where you start seeing Chad and Nigeria and Tanzania. Look at that. And here's what's really scary. Do we have it in there? Right down there near the bottom is, guess, none other than China. China, there it is, number 208. The actual source for this virus, whether it came from a lab or a bat, we're leaning towards lab in China. Somehow the place that didn't know it was happening, knew nothing about it, was the first hit and caught by the most surprise, is doing better than almost the entire world. Huh? That's really weird, isn't it? How strange. There we are, Tony Fauci. That's what he should be proud of. But I want to show you something. As I was ranting about this, obviously, as I am right now with my team. I said, can we see this, so the overall death rates? And here's one of the things that you have to think about. We know that as cases rise, then we'll see a rise in deaths, right? And there's been charts that look at that. I want you to look at something. This is the chart from the EU, from Europe. And this is charting out the different countries and their death rates as they go up. And as you can see, as they had higher rates of infection, they also have higher rates of death. Now, when I look at charts like this, and I do it all the time, it's not something I planned on doing with my life, but somehow this is where I've been guided. But I look at these charts sometimes, I think, yeah, I see how you've drawn that straight line, but it's really kind of all over the map. I mean, I guess that's sort of the direction it's heading. And that's what that R value up is. They're saying, yeah, we see those ones that are really out of line. So they're saying it's about 79% within the threshold of moving. And this is cases going up with deaths going up, right? But you see how kind of random that is. Yes, it moves in the direction, but pretty randomly. I want you to look at something really weird. We pulled up the United States of America. Take a look at this. Here are the states inside the United States of America, those that are the hardest hit, and the numbers, they all go up. And as the numbers go up, obviously so do the deaths. But look at that pattern, folks. That is not zigzagging anywhere. I want all of you that are mathematicians, or maybe you work for the IRS or you're a tax accountant. If you were doing an audit on somebody and their numbers almost drew a perfectly straight line where they didn't deviate at all, where it is exactly as the cases go up, so do the deaths. And literally, I mean, look at those dots almost draw the line. Folks, that is unnatural right there. It is reaching a 97% threshold. That's how accurately the deaths go up with our rise in cases. So when you look at that, you know, someone in the IRS would say, we got to do an audit there. There's obviously someone lying. And we're trying to figure out what explains that. What explains that perfect line there that there's nothing in nature that works that accurately? So either these are totally manufactured and synthetic numbers that we're being delivered here in the United States of America, which could be the case, or you have some mechanism by which that we're almost following a plan. It's almost like it's planned out that as things rise, we see a perfect death rate, as though somebody, somehow, we make sure you die when we hit certain percentage rates. I don't know. I mean, it boggles the mind. But when it comes to a plan and what would be behind it, this is one of the conversations we have. People say, Del, you know, you're saying that doctors are lying or that doctors are killing people. I've said from the beginning, doctors are just as clueless as most people in the population. None of my doctor friends know any of the data points that I know. They haven't looked at the Pfizer documents. They haven't looked at, what's happening inside of hospitals. They don't read about ivermectin. They don't read about hydroxychloroquine. In fact, a doctor friend of mine, that's exactly what I said. Well, what are you using inside the hospital? Well, we use remdesivir. I was like, you realize that remdesivir showed absolutely no benefit in almost every study that was not manipulated by Tony Fauci himself? What, have you tried hydroxychloroquine or ivermectin inside of your hospitals? Well, no, they don't work. How do you know they don't work? You tried them and you saw with your eyes? No, we were told they don't work. I said, you see, this is the problem. And when you think of that list, right, when you think of that list, who's at the bottom of the list? Who's not got high death rates? Like the entire third world, like everybody that just so happens to use hydroxychloroquine because they have malaria in that country, or ivermectin because they have different parasitic diseases. That's being widely distributed all over India. Guess what? They don't have a high death rate. So you're telling me the third world that's using the drugs that we don't allow in our hospital, that they're doing better than us? All of these things are things we're going to really start to expose this year. We got to get to the bottom of this because people are going to go to jail for crimes against humanity. I'm sure of it. But to get into more detail, I actually want to bring on a public health analyst that got a team together and said, what would be incentivizing? If you were going to try and create a plan that created a pandemic maybe, or a very high death rate, what would you have to do? You'd have to incentivize that in some way. And we've been asking the question, where are all the incentives coming from? Well, we've talked about a few of them, but right now I want to bring on AJ Depriest, who got a team together. AJ, thank you for taking the time. We ran into each other at a function just a couple of weeks ago, and you blew my mind with what you were telling me. So I'm going to hand it over to you. First of all, how did you get into sort of looking at the data and looking at sort of incentive projects happening from our government?
Thank you, Dell. It's so good to be here. Thank you for giving us a voice. About a year ago, 28 people got together, all volunteers, and formed Tennessee Liberty Network. It's a small think tank here in Tennessee.
Okay.
We're not controlled by anyone. Nobody gives us money for anything. And we wanted to do some research into the CARES Act money coming into the state to find out how exactly all the different areas of our state were affected by that money. We didn't find anything really untoward there, but when the American Rescue Plan Act was signed by Joe Biden in March, early March of 2021, was about the same time that we started going to school board meetings and discovering that there was this very disturbing trend of parents and citizens standing in front of school boards crying and begging for their kids to be unmasked. And
Yeah.
yet the school board members kind of sat there glassy eyed and sort of like zombies, almost like they didn't have a say so in the matter. So
Right.
we decided to dig into that and discovered that the school boards really don't have a choice in the matter.
Okay. How's that?
In the CARES Act, ESSER money, that's elementary and secondary school emergency relief money, was ESSER 1 and 2 were released under the CARES Act.
Okay.
ESSER 3 money, which was more than any money ever given to schools ever by the government, was released shortly after Biden signed the ARP Act in March 2021.
Okay.
And yes, this is a great graphic here because you can see that in December 2020, the CDC released a report saying that it would only cost $25 billion to get every single school in the United States up and running.
Okay.
And to date, schools have been given almost $200 billion in COVID
Wow.
relief money. Yeah, big carrot, right?
Yeah.
Big carrot.
Huge. Well, where's that money
So,
going?
well, it was going to a lot of things to help schools with, a lot with like tele-school choices
Right.
because a lot of the rural schools didn't have ways for kids to attend school online. So that was really great to do. And, a lot of health-related things, a lot of sanitation issues,
Okay.
being fixed in schools. But we started to ask, why, if COVID is so deadly and masks are so necessary, why aren't there any OSHA-regulated hazmat bins in schools?
Right.
Something's up with this. It can't be about health and safety like they're telling us. So we looked into the ESSER 3 money, which is the most schools are given.
Okay.
And we found that Tennessee had to submit a district plan. And not only Tennessee, we discovered that every state submitted their district plan. Our Commissioner of Education, Penny Schwinn, submitted our plan. It was approved by Miguel Cardona, the Secretary of Education up in the swamp. And this plan is something that schools have to submit every 6 months through September of 2023. And they have to prove how they are universally masking children. Find this online and look for it in your state and go to the requirements. To get this money, they have to do these things: universal and correct wearing of masks,
Okay.
physical distancing, hand washing, cleaning, ventilation, contact tracing, quarantines, isolation, and second to last on the list is vaccinations. This is why they're getting the money to mask your
So when we're
kids. It
standing there
has
as
nothing to do
parents,
with health and safety.
So when we're standing there as parents at these school board meetings and saying, get the mask off my kid, they're getting rashes on their face, my kid's depressed, and they haven't seen their teacher smile, they're not interacting socially, I see them failing, and we just see those blank stares because that school
Yep.
board knows I'm not going to turn down, what is it, $10 million or $15 million
Oh,
to listen to you?
much more than that.
Really?
In Tennessee, Shelby County, Memphis, Shelby
Yeah.
County gets almost $750 million in COVID relief funds.
For
Yeah,
education, just
Davidson,
to the schools.
yeah, to the school system, Shelby County school systems. The
Hundreds of millions of dollars.
Nashville Public Schools is $500 million in COVID relief funds. But to get that money, they have to prove how they are fulfilling these requirements: universal masking, contact tracing, isolation, quarantine, vaccinations for all students, staff, and teachers. To get that money, they have to fulfill those requirements. That's what we discovered, and every state is doing it. So we want parents to stop going before school boards and crying and begging them to release their kids from masks. Just stop it. Okay, find this information in your state. Contact us and we'll help you. We'll point you in the direction to find this
Okay.
information. Take this in front of your school boards and confront them.
Right.
Ask them, how much money are you taking from the federal government to commit this egregious, tyrannical behavior on our kids? And if they don't know, tell them how much it is and tell them to give that money back.
Fantastic. Absolutely. I mean, this is something that I suspected. I suspected that this was going on. There's got to be a payoff that's going on here because it doesn't make sense. These school boards aren't acting naturally, and they
They're
don't seem to
not.
care. And so that is huge. Hundreds of millions of dollars just in one school district there. And you're saying that's happening all around the world. Of course, they're not going to walk away from this. So when, as
No,
parents,
no.
we got to recognize, like, you got to know your enemy, right? Your enemy is money. Right now, you are asking your school board, when you're thinking it's just about a mask and whether they care about your kids, they're not going to walk away from hundreds of millions of dollars that are coming again. Here's all of
That's right.
Tennessee. Look at that. Look at, these are the
Yep.
numbers as they break down. Billions, literally billions of dollars being funded to imprison your child, to socially distance them, to shut down their school or make them wear masks. All of that is being funded against you by your president, by our administration, and probably more specifically, a lot of this comes out of the NIH and the FDA, CDC, all these. So Tony Fauci is probably behind a huge part of this, and those that represent that. This is how a small group of people infect and make everybody evil. They force them into it by funding them, giving them the biggest carrot known to man. So how does this translate? I started by talking about hospitals, and we're seeing this incredibly, almost like planned out death rate. We've talked about some of the funding. You decided to sort of get into hospitals too, right?
Yeah, Tennessee Liberty Network, about the time that we finished wrapping up our deep dive on the education money, we started getting calls from people looking for help because they had loved ones in hospitals that were dying. And we started looking at the cases in Tennessee. And to date, we've lost about 20,880 people in Tennessee in hospitals. These people aren't dying at home
Right.
from COVID. They're dying in our hospitals. So we started looking into that and tracking the money from the ARP Act as well. And then we figured that there had to be more than just the ARP. And so our research has led us to discovering that the CMS is also heavily involved in funding hospitals and these deadly protocols. And so we confront these hospitals daily now.
Hmm.
We formed another organization called the Atom Group, and we have a website, theatomgroup.net. Thank
Okay,
you.
great.
There it is. And our goal is to educate people on how to prevent COVID because it is preventable,
Right.
and how to treat COVID at home because it can be treated at home without going to a hospital. Our goal, the number one goal, is to keep people out of hospitals because we know from experience what happens there. And the advocacy work that we do with people who are in hospitals, it's the stuff of nightmares. It's nightmares. In Tennessee hospitals get $166,000 for every COVID patient in a hospital.
What?
$166,000.
I mean, I
West
remember.
Virginia,
Oh, well, hold on though. $166,000. I'm trying to wrap my head around that because I remember we've talked about, like, early on it seemed like there was like $13,000 to be diagnosed with COVID. I remember something like 26,000 being reported, and Scott Jensen, who I believe is running for Senate, risked his. Oh, actually, I think he's running for governor. Governor, I mean. Up in Minnesota, but he came out and said, we're being incentivized here, folks, to take anyone we can to make them a COVID patient and then to put them on a ventilator. And so those numbers were like 13,000, 26,000. But you're saying, oh my God, so these are other states. Nebraska is getting
yeah,
379,000 per COVID patient in the hospital. West Virginia,
yeah. Look at West Virginia.
471,000, 339,000 North Dakota. So what do they have to do to get that money for that patient?
They have to follow the NIH protocol for the treatment of COVID in hospitals. And they will tell you, oh, we don't follow NIH guidelines. We follow the CDC guidelines for inpatient treatment of COVID in hospitals. But if you go to the CDC website,
Yeah.
it points you right to this document right here, the NIH protocols.
So
And the
CDC, they say no,
protocols
we go
for,
with CDC, but that puts you back to NIH, who's really
right,
actually in
right.
charge.
It'll point you right back to the NIH. It's right there on their website. There's a link that says, this is the protocol that we follow, the CDC, and it
Right.
takes you right to the NIH website. There's a link there. So they can try to obfuscate and point you in another direction, but it all leads back to those NIH protocols that in those protocols, the only approved EAU drugs for the use for use in hospitals for COVID starts with remdesivir.
Right.
And the reason why other countries don't have the death rates we do is because the United States, for the whole year of 2021, was the only country that was allowed to use remdesivir.
Wow.
Fauci
Lucky
and his
us.
team
Lucky us.
yeah, I know, they
I
bought
mean,
it all
a
up and they've
failed, as
been
I put it
using it.
out, and if you're brand new, a failed Ebola drug that was so toxic, they said, you're better off with Ebola. We're pulling it out of this trial.
Right.
But, oh, hey, let's use it for a really bad cold and give it to everybody. And when I think about this, right, we send people into hospitals. Once they get there, I mean, first we send you home if you don't have low enough oxygen levels, because for the first time in history, early treatment is not the answer. Go home, get more sick, then come back to us when your lips are blue. We put you on a
So we can
ventilator.
kill
We
you.
give you remdesivir. What is remdesivir? Shuts down your kidneys, which fills your lungs with
Mhm.
water. Now we say you're dying of pneumonia. It's actually a side effect of remdesivir, and boom, perfect line of deaths of everybody walking into
Yeah.
hospitals. Well done. Are they
Remdesivir
incentivizing it though? Are
leads
they
to
beyond that? Do you get paid in any way, like the ventilators or
yeah.
things like that we're talking about?
Yeah, I think Dr. Jensen said it earlier on your show, $39,000 for every COVID patient on a vent. They
Right.
get paid, hospitals get paid a fortune just on these faulty PCR tests. They get the test for free. The government pays every time they administer a test. They pay for every positive test. They pay for every test that results in a hospitalization. So they make a fortune just off the faulty tests alone. Then they get paid for every COVID patient, the $166,000 in Tennessee. And then they get $39,000 for every COVID patient on a vent. Plus, there's a 20% bonus add-on, which is a weird thing to call something when you're murdering people. There you go, 20% for using remdesivir and the ventilators. the CMS is responsible for that. That's the Centers for Medicaid and Medicare. They've got their hands, all their fingerprints are everywhere, all over extra payments to hospitals for killing people. But here's what I want to point out about the
Okay.
NIH protocol, because people are going to court begging for the use of ivermectin and
Yeah.
HCQ. If you go to the NIH protocols and you read those protocols, believe me, we've read them cover to
Yeah.
cover, and it's a big document, but there's very valuable information in there, because ivermectin is actually listed as number 4 in
As
that
possible
document.
treatments or usable
But
treatments for it. Right.
right, it's in the NIH protocols, but the FDA has not given ivermectin an EAU approval to be used for the treatment of COVID in hospitals. It's in there, but remdesivir and those covered countermeasures
Yeah.
like remdesivir and the ventilators are the only ones that are covered under the EUA for use in hospitals.
Wow.
And if you want to throw one more wrench in the spokes, the PrEP Act. The PrEP Act protects all the hospitals and doctors from full liability
From killing you
for
with products that don't
injury.
work. Right.
Yeah, for injury, even death. They're
Yeah.
completely protected, but not if they use ivermectin. It's only for the covered countermeasures, and that's remdesivir and ventilators.
I mean,
But
that's,
I want
yeah.
people to go. I
Yeah.
want
Go ahead.
people to go to page 33 of the NIH protocols, because on page 33 there is a section called Evolving Knowledge on Treatment of COVID-19. And in that section, it clearly says that providers can access and prescribe investigational drugs, even off-label drugs like ivermectin. And the very last paragraph, it says it's important to stress that the rated treatment recommendations in these guidelines should not be considered mandates. The choice of what to do or not to do for an individual patient is ultimately decided by the patient and their provider. So anybody who's out there fighting to get ivermectin and they're in court and they have a lawyer, take page 33 out of the NIH, because this gives the hospital permission. They may not make all the money that they make off of remdesivir
Right.
and the ventilators,
Right.
but this gives them permission to do it. And if a lot of doctors and hospitals really, if they take their Hippocratic oath seriously and they read this from the NIH, maybe, just maybe, they can form a coalition and start fighting back against these hospital protocols and saving some lives.
Fantastic. AJ Depriest, that's amazing work. And I want you to really listen to what's just happened here. When you're advocating for your loved one in a hospital, should it get that dire, hopefully you've been watching this show. You're taking all of the different things that, we take here. You got your zinc, up levels up, your vitamin D levels, we now know are very important. You're doing the preventative things, hydroxychloroquine, ivermectin. I hope you have, your stash ready to go should that moment come. And look, there's always a chance in any situation that it gets out of your control. I understand that. But if you find yourself in a hospital and they're not treating you properly, look what you're up against. That hospital wants to make that $350,000 being handed to them by these ghouls, by these people that are pushing up an agenda and a plan, whether it's to kill you on purpose. I mean, it's hard to imagine that it's not with those levels of numbers. That funding is coming to do the things that are going to kill your loved one. That's really great advice in their own websites. And this is what we do here. We use their own evidence against them. They're telling you that ivermectin is acceptable. You're just not going to get payment. So when you're looking at the hospital, remember that doctor does care about you. They don't even realize that it's their boss, the hospital owners, these hospital malls that are taking these incentives and laying the mandate down saying, ivermectin doesn't work and neither does hydroxychloroquine, because they need to make that money. And that's why they need to do it. AJ, we looked up a number. We looked at something when I knew you were going to come on. I want you to take a look at this because I think it really just puts an exclamation point on the work that you've done. We looked at back, this is July 17th of 2020, Health and Human Services announces additional distribution of funds to hospitals with high COVID-19 admissions, meaning we want you to have high admissions. Remember, we started shutting down oncology units. We started shutting down the heart, programs and the diabetes only to cover COVID. Why? Because we're going to give you extra money. And in that document, it basically lays out that we're going to give you, I think it was 50,000. HHS will distribute funds in hospitals with more than 161 COVID-19 admissions during this time period, which equates to 1 admission per day. It also will distribute funds to those hospitals that experienced a disproportionate intensity of COVID-19. So get those cases into your hospital that exceed the average ratio of COVID-19 admissions and beds. Hospitals will be paid $50,000 per eligible admission. Look, that's July 17th, 2020. You want to see something really interesting? Remember, we shut down half of our hospitals. All that money that comes in for cancer, all that money that comes in for heart disease disappeared. All there was with COVID. Well, look, this is just one of the hospital systems that's this is the stock tracking. Look at the S&P 500. Look, it tracks. The green there is this HCA. That's a hospital group that does very well. It kind of goes right along with the index. But look, right in there around May and then July, you start handing them giant funding. Look what happens to their stock. They stop treating cancer. They stop treating heart disease. No money coming in from anything else except the government paying you to kill people with remdesivir and ventilators, and now you're more profitable than you've ever been. That is absolutely shocking, and it's deplorable, and I don't think it's going to age well in our history books.
No, it's not. Del, there is a hospital very close to me here in Tennessee that was interviewed for an article in a paper, and they were bragging about how for the second year in a row they're operating in the black after never operating in the black. And they were bragging about all the new equipment and technology they were going to buy and all the new wings they were going to build to the tune of about $19 million. It was disgusting because that hospital alone, we've lost almost 24 COVID patients in. They've killed them by remdesivir and ventilators.
Wow.
So we want communities to start getting more involved. And when you know these hospitals are doing that, the people of that community need to show up at that hospital in mass and start telling them that you as a community are going to be advocating for every single COVID patient that walks through those doors. And you are going to hold that hospital accountable to their patient bill of rights, to their stated visitation policies. And if your state is not in a state of emergency anymore, there shouldn't be any reason why patients are medically kidnapped and separated from their families and isolated. There's absolutely no reason for it, but the communities have to get involved and they have to confront these hospitals and tell them, we're done. You're not killing any more of us.
Amen. AJ Depriest, mirroring the words that came from Dr. Mark McDonald earlier. It's about community. We've got to find our community. We've got to get vocal with our community, and we've got to stop this insanity now. I don't know if it's on purpose, but they are murdering a lot of people. I know that Robert Malone said in his interview with Joe Rogan, they have killed 500,000 people at least. It's scientific. We know it. People that did not need to die, should they have had access to the drugs that we know work in all the third world nations that are beating us right now when it comes to COVID. AJ, it's people like you that make a difference, that put together a group to just do your own work. Nobody funded you. Nobody made it happen. You got out there and made a difference. You're a true hero, and I want to thank you for taking the time sharing your data. And for everybody out there, a lot of this goes flying. It's live. We'll make sure the links to all this data is there for you as we provide it to you on Monday. You want to go back and really look at these documents she's talking about. You want to find that page 33. You're going to be sitting to yourself saying it was on 33 page somewhere, something. Just sign up to our newsletter, and that information will be in your inbox on Monday. AJ Depriest, you're a hero. Keep up the good work, and we'll have you. Any new discoveries you have, please let us know.
Thank you, Del. We love you here in Tennessee.
All right. You take care.